Follow these instructions to help with your recovery. Be sure to elevate your leg above your heart and ice your knee for the 72 hours after surgery. Limit your activity during this time to reduce swelling and pain. You can remove the bulky dressing 48 hours after surgery, but keep the steri-strips in place for 12 days or until your first follow-up appointment. You can shower over the steri-strips after 48 hours, but remember to apply a clean dressing until all the drainage has stopped. After that, only the steri-strips need to stay in place. Do not submerge your knee in water. TED hose should be worn for 2 weeks to reduce swelling, but they can be removed for 2 or 3 hours a day. If you were given an ACE wrap, use this for the first 3 to 5 days as needed. Pain medication will be sent home with you. Aleve, Advil, or ibuprofen can be used along with this as directed on the bottle. Remember to use ice for the first 72 hours after PT. Use your crutches until you are able to walk without a limp or otherwise directed. Your doctor will discuss with you when you may drive. This decision is based on a number of factors, including the knee involved, whether you drive an automatic or stick shift, the nature of the procedure, your level of pain, whether you are using narcotic pain medications, how well you can control your knee. Typically, patients are able to drive from 1 to 3 weeks after the procedure. The brace should be worn at all times except when bathing until your first appointment. The brace will be locked unless you are walking with crutches or performing the sit and dangle over the edge of the bed. Begin exercises as instructed the day after surgery 3 or 4 times a day. Perform exercises 10 to 15 times as demonstrated in a slow and controlled manner. We will discuss formal physical therapy with you. The most common complications are infections, blood clots, accumulation of blood in the knee. The warning signs you should look out for are fever, chills, persistent redness or swelling in or around the knee, and increased pain in your calf muscle. Unless you have had a ligament reconstruction, you should be able to return to most physical activities after 6 to 8 weeks, or sometimes much sooner. Higher impact activities may need to be avoided for a longer time. You will need to talk with your doctor before returning to intense physical activities. If your job involves heavy work, it may be longer before you can return to your job. Discuss when you can safely return to work with your doctor. Once again, thanks for choosing us, and contact us if you have any questions.